Hello, everybody, and welcome to our Health Awareness Day. We have a lot of brilliant speakers coming in today to talk to you and inform you guys about a lot of information. But first, I'd like to have a few words from Pastor Greenaway. Thank you.
Thank you so much. I'm just glad to be here this afternoon. My name is William Greenaway, better known as Lennox. That's my birth name, really. Um, I'm glad to be here to open up in prayer. But before I do that, I just want to read portion of scripture, not really long. And before I do that, thank you, Kelvin. When he invited me, I responded. I don't know why I responded so quickly to be here today. I just sense, I just felt a sense of urgency to be here. And I just want to read some verses of scripture here before I pray. Psalms 30 says, I will praise you, Lord, because you rescued me. You did not let my enemies laugh at me. Lord, my God, I prayed to you and you healed me. You lifted me out of the grave. You spared me from going down to the place of the dead. Sing praises to the Lord. You who belong to him, praise his holy name. Another portion of scripture says, Psalms 103 says, my whole being praise the Lord. All my being praise his holy name. My whole being praise the Lord, and do not forget all his kindnesses. He forgives all my sins and heals all my diseases. And the reason why I chose those two portions of scripture, I just want to introduce to you today, and to those who have forgotten, somehow you have forgotten, that in addition to the healings that come from medicine, and I don't want anybody to think that I am against medicine. The healing that comes from medicine, the wisdom that comes from the doctors, comes from God. All the advances and the discoveries that have been made, they have come from a higher wisdom. So it is necessary for us, and I think it is wise for us to utilize everything that God has placed in our ways to help us with our diseases and our sicknesses. This body is prone to decay. We are all going to decay, but in the meantime, there is help through medicine. And I also want to introduce today, and when all else fails, and even when you're taking medicine, you can still call on him, and the one who gives the wisdom, because he says, and David recognizes the importance of God in his life. He says, and twice he's saying it, the God who heals. So, and I know many times, and at this point in time in some of our lives, at this age, when we hear certain news from the doctors, it brings on an anxiety in our minds. So when we are alone and in the times when nobody's around, we have him to call upon. He says he heals also. So you have somebody to talk to, somebody who counsels you in the absence of others around. And I can testify that I have experienced that kind of healing, spiritual healing also. But I want to encourage everyone here today to make use of the medicine that is available to us, the help. And I just want to say one thing before I pray. I didn't realize that this writing was on top here. At the beginning of the week, I think was Monday, I went to my doctor and I was violated I was sexually violated. And then everybody's watching. No, I had that test, the real one. I had the blood test and it says it's okay. And then the doctors decided, well, look, you need to do the other one to verify, to make sure that everything is all right. And I've never felt so uncomfortable in my life. And we as Black men, we have a kind of, I don't want to use a strong word, ignorance, but we are afraid to do that test. But it is best for us to be uncomfortable for a few minutes. As soon as it finished, it was done, I felt normal again. Okay? And if it is that we have the perception about, I know about men going, invading your privacy, then let the female doctor do it. You feel much better. But at the end of the day, you have peace of mind, knowing that everything is all right. And if they discover it early, then you have help around that will help you. Bow your heads with me. Father, we do thank you today. I'm glad to be here. Glad you have allowed me to come safely, oh God, and travel safely today to be here. I thank you for your holy presence. You are everywhere at the same time. And I'm thanking you that you are here by your Spirit. And I'm just asking that you will conduct things today. Everything will be done to bring glory and honor to you. Every message that is brought here today through the speakers, oh God, you would open our understanding, enlighten us, oh God, so that we can be healthy, we can do what is right. So I'm praying that you would direct. I pray that you would bless everyone. This day would be a day that we would all remember. Somebody's life will be transformed today by the information that is given. And oh God, we will at the end say it was good for us to be here. I pray that you would cover us all, you would bless us, you would keep us, you would minister to us all. And even right now, Lord, somebody who is sitting here not feeling well in body, I know, God, that you are the divine, the healer of all healers. When all else fail, when nobody knows what the cure is, you, because you made us, you are well able, oh God, to heal. You said it in your words, oh God, over and over. You are the one who heals us. So God, touch somebody even right now without even medicine, and let your spirit and your power, oh God, rest upon somebody to heal them from the sickness or disease that they are carrying. Right now, in Jesus' name, I ask. And I say, thank you. Thank you for this day. Thank you for everything. Thank you for every speaker. Thank you for all who listen today, and bless us in Jesus' name. Amen. Amen. Now hand over to.
Thank you, Pastor. Thank you for those words. So, today we are here for Health Awareness Day at the Main Culture Salon. But before we get into the speakers, I just wanted to talk to you a little bit about the journey and Kevin's journey to how this came about. So, 8 years ago, Kevin was in the hair salon with some of his friends, and they were talking about their love for Neasden and the community and helping mental health wise and physical health wise. As you can imagine, in a hair salon, you talk a lot to your barbers and your hairdressers about your mental health. You know, you open up a lot, just like how our pastor said. A lot of Black men, unfortunately, don't open up about things that are troubling them with their family. They feel this kind of burden to be strong and hold it all in. But Kevin speaks about how he's heard a lot of stories from Black men and opening up. And he thought he wanted to do something with this information. He decided to use Main Culture as a platform to help these people in Neasden and the whole community. And since then, it's become what it is today. He's using YouTube to stream it so many people can hear, and people can hear about mental health and our speakers' information. So thank you, Kevin, for helping the Neasden community. And without further ado, I'll introduce you to Blaze, our presenter for the rest of the day.
Wow. That's super. Guys, I have to say good afternoon and welcome. But I have to start by saying how super proud I am of our first speaker. That is the young Tia Bernard, because I met her when I was here last and she expressed an interest in doing what she's just done today. And that was absolutely magnificent. I am super proud of her. She's a new presenter on the Chalk Hill community radio station, of which I manage. And I'm supposed to be mentoring her, but I don't know, she might be mentoring me, because that was absolutely wonderful. So Tia, I'm really proud of you. Thank you for that fantastic introduction. You've done a great job. So let's put our hands together one more time for the fabulous Tia Bernard. And also to say thank you to the pastor for those wonderful words and sharing his brief story about his experience with prostate cancer. So my name is Blaze. I am, as I said, the manager of the Chalk Hill Community Radio Station, and I am the host of the Let's Talk show, and collaborated with Kevin, I think, from the very first one. I think I was supposed to be a guest, and I've never left. It's a wonderful, wonderful idea to use the barbershop as a community space, because we have very few community spaces. And so what a great space to have this conversation, and a great use of the space. And I'm glad that you guys are here today, because it's Sunday, and sometimes it's more important to have rice and peas or watch Columbo or whatever it is we do. But the fact that you're all here today is fantastic. So we're going to kickstart the day with something very special and wonderful. It's somebody who I've grown very fond of, and he's going to share some wonderful words. He's going to start with a poem. And so we're going to invite Ronald. Are you ready to do your poem now, or would you like a few moments? Are you going to do your poem now? What do you think? You can have a few moments. So we're going to give Ronald a few moments. But what's going to happen today is that after Ronald's done his poem, which I know is going to be wonderful. In fact, I wrote one for him today as well, actually. It's all about smiles. Ronald's very much into people smiling and being happy. But today we're going to have Ronald's poem, and then we're going to have a presentation from Dr. Consultant Jonathan. He's going to do a presentation for us. And then we're going to have Gussie from Roots FM, very well known in the community for a number of reasons. And it's great that he's going to be here today telling us his story. And also we're going to have some words with Hasna, who I met here also. And she's going to be talking about her journey in relation to mental health. The really wonderful thing about today is that on Tuesday last week, I was recently appointed, let me see if I can get this right now, the community something. Anyway, I'm going to be working around cancer, community cancer awareness person, advocate, something. But I'm going to be doing some work with people and their story about cancer and how that affects people from different communities. So I'm really excited about that and glad that some of my journey started right here at Main Culture. So thanks to Kevin and the team. So Ronald, how are we doing? Are we good for your poem now? Good. So guys, give him a really warm round of applause and make him feel warmly welcome. Ready?
Okay. It's not what I expected, and I'm not a public speaker or even somebody who speaks in front of many people. I used to live in this area many years ago. I still feel very much a part of this community, and I'm very passionate about health awareness. Over the last few years, I've had a stroke. I've had 2 strokes. I was diagnosed with onset of Alzheimer's. I've also had 2 prostate operations, not prostate cancer, but related to prostate issues. And I've learned about the importance of opening up about your feelings and talking up as opposed to keeping things contained. I've also come to understand we can all be vulnerable to mental health concerns. And I think there's a lot of beauty in vulnerability. And as someone who grew up always being on the edge of life and being very much supposedly pretty tough and pretty hard, I'm just loving the symptoms of vulnerability in me. And it's possible for you to still have the lion in you and be everything you are in terms of being strong, but don't be shy about releasing the vulnerability. I wrote a poem. I'm a bit nervous here. Okay, Gussie told me just to be open, open up, and I wrote this poem because I went through an ordeal of experiences with social services, and they just didn't see me. And it's so easy to be not seen when there's so much of you who's there to be seen. And after my stroke, they were encouraging me to be reliant on medication. And for 4 years, literally, I was reliant on medication. I was going to a place for brain injury called Edway, and I was always being encouraged to slow down, take it easy, Ronald, and take your medication. Fortunately, there were people in my world who came and found me. I say they rescued me, and they used to bring me to London and get me involved in meaningful activities. And then I wrote this poem after speaking to people who should be seeing me and not seeing me. I wrote this poem. Make sense of it, please. Where is it? Okay, the poem. You come to see me. You come to see me, but you don't see me. We have a conversation, but you don't hear me. And I've been thinking, if you don't see me, how are you going to know what I'm thinking? Your eyes fixed on me. Sometimes you smile. I always smile. And I wonder if you know why. But if you don't see me when I'm speaking, how are you going to know what I'm thinking? And if you can't hear me when I'm calling, how are you going to know that I'm falling? And though I no longer dance beneath quiet skies, nor run across open fields, I wonder if you'd believe the mountains I still climb. Thank you.
I so adore Ronald because he knows not or he remembers not of his greatness. And that was a wonderful, wonderful piece. How's the mic sounding? I'm starting to feel like the mics are not. Are you guys hearing me okay? Is that good? It's because the other one sounded like I couldn't hear. So that was really wonderfully, beautifully introduced and wonderfully read. So thank you, Ronald. That was wonderful. Let's give him another round of applause. That was brilliant. Okay, so without further ado, I'd like you now to put your hands together and welcome to the stage our consultant, Jonathan, who's here to talk to us today about prostate cancer.
Thank you very much. Can we project the slides? No. Hello, hello.
Yeah. Can we do anything with the mic?
Hello, 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 hello.
This one was better.
Hello, hello, hello. Okay. Can that go on full screen or is that the best? Good afternoon, everyone. I'm Jonathan Noel. I'm one of the consultant urology surgeons at the NHS. So I work at Guy's Hospital, Lewisham and Greenwich Hospital in Southeast London. And I've come to do a few of these talks here, and each time I learn something new. It's never the same event. Someone always asks something or says something and it gets you thinking. And for me as a clinician, I think it's good to really learn from what the views are of the community to just be better. So do press me with your difficult questions or statements, and I'll see if I can return a satisfactory answer as well. So this is a conversation. It's two-way. I will show a few slides. I'll happy to be interrupted with questions if you so see it that you will have a burning question. You can see at the top of this slide is a logo. I don't know if anyone is familiar with what it shows. It's projecting pretty poorly. Either you know or you don't know. If not, we'll go through it at the end. That's my last slide. So next slide, please. Maybe there's a delay in showing it. So just press it once, but hopefully we'll project. So what's the prostate? Prostate is a reproductive organ that's just underneath your bladder in a man. So when it has trouble, the most pressing symptom is there's a change in you passing urine. It contributes to production of sperm. So again, you might have some issues with that if it's diseased. Next slide, please. I think it's an important matter to discuss openly because there's a lot of information, some good, some bad, some misinformed, some not so misinformed. But I, for one, have worked with this a lot because in time for my accent, I grew up in the Caribbean, and you know, it's probably the most prevalent disease in the population there. At the age of 50, through your tissues being more sensitive to hormones, it starts to change. And it can change to be large, it can change to be uncontrolled in its growth, which means cancer. But sometimes when it changes to cancer, you have no symptoms at all. And that is the reality. And that is why screening, in my opinion, should be strongly considered to be mandated, particularly in a population or in people who have a higher risk compared to 1 in 8 for white men, 1 in 12 for Asian men. But it isn't. Next slide, please. So it can change in various ways. I think some of our speakers have spoken about how it can enlarge and cause some obstruction, and then you're passing urine a lot slower, and then you need an operation to open up your channel, so to speak, and then you pass urine over the wall again, like you did when you were younger. That's a benign enlargement. It can be inflamed, it can be irritated, it can cause a lot of pain down there. That's usually infection or inflammation. That's treated with antibiotics, no surgery needed. We can go through the next slide. But in regard to cancer, like I said, if it's in its early stage, you have no symptoms. And I think you have to be very wary about that and present for a simple blood test called a PSA, a prostate-specific antigen. And that PSA can actually be an indicator as to whether you need further investigations or not. It is not the silver bullet to find out whether you have cancer or not, but it is a suggestion. And knowing your number is a good thing to have because you can track it every year. If it's nice and low every year, you've got that reassurance. So prostate cancer is unchecked cell growth. It's just growing and growing and growing and not canceling it out. It's like your hair. We're in a barber shop. Your hair cells. The cells reproduce and grow and grow and grow. And for some men, it doesn't grow as fast, and you know, you're balding and stuff like that. But it's just all about a positive, negative balance. That's the body. Grows, and the growing rate slows down as we get older. But with cancer, that growing is just unchecked, and it keeps growing and growing and growing. And it's slow growing for the most part, but there are no symptoms in the early stage. I've said this 3 times now, probably said about 10 times, because this is really the important message I want particularly men to take away, is that the early stage of prostate cancer has no symptoms. How are you going to know? If you wait for symptoms, more than likely it's a bit advanced. Next slide, please. So about the age of 45 in my book, you would start to engage with your general practitioner, get a PSA blood test. It's been proposed to start earlier. I think if you have a very significant family history, your father, brother, uncles had prostate cancer very young, you should probably start earlier, age 40. I get questions all the time about starting earlier than that. That opens up a different conversation that I don't think we have all day to talk about. But prostate cancer, as I said, is the most common cancer in men. 129 men diagnosed every day, according to Prostate Cancer UK. And the stats are there, 1 in 8 overall, but 1 in 4 Black men. And the risk increases, next slide, please, as you get older. I'm preempting the slide change because there's a little bit of delay. But also important is breast cancer is related for some patients. So if you have a history of breast cancer in your family, that can be genetically passed down and translate to prostate cancer in men. So the PSA blood test can be high, may mean that you just have a big prostate, may mean that you have cancer, may mean that you either had recent intercourse and that's why it's gone up. You recently went on a long haul flight to the Caribbean, wherever. You're a keen cyclist or a horseback rider or something, and your prostate's been irritated, and that's caused a false elevation. So what you do is you let your GP or your health professional assess, repeat it. If it goes down, all right, off you go. But knowledge is power, and I think, community knowing this is really important. Really important. Next slide, please. So PSA blood test, familiarize yourself with it, what your normal number is. I can always point you to websites for your age, your specific age range. But the screening for prostate cancer is seen as controversial across the UK. And there is no national screening program. There is none. Hopefully it changes. But it can help us find aggressive cancer. It can help us find cancer. It can be a segue to knowing that what your baseline number is. So they say that if your PSA is less than 1, about age 50, chances of you developing cancer are so low. This is not a reassurance for some. Wouldn't you want to know that? Next slide, please. Well, why is it viewed as controversial? I suppose it's because it's slow growing. You find it early, you just create a lot of anxiety for some patients. We've been speaking about that outside. Some patients can be really knocked back by even the suggestion of it and can affect their livelihood, their ability to work, focus on other things. So I appreciate that. Next slide, please. But the prostate is there. And when you examine, and I say examine very clearly, when a doctor wants to examine the prostate, finger in the back patches can pick up 70% of cancers if it exists. That's the reason why we examine you. The same way a woman comes with a breast lump, she's examined by a doctor. Woman gets her cervical screening, she's examined. Man has colon problems, he's examined the exact same way. Prostate, examined the exact same way. It's an examination. It's serious. We don't do it to make you uncomfortable. We know it's intrusive. You have every right to ask for a different clinician if you so wish, which was spoken to earlier by the pastor. And I think that's important. You must be comfortable. You have that right to. But the examination, if it's done, it is to serve a purpose, to find something early. Now, MRI prostate is completely changing everything. MRI prostate, I think UCH just came out with a study that showed that MRI prostate was more sensitive than the PSA blood test. We could screen everybody in an MRI. No examination needed, no blood test needed. And I speak about this and I think about my family and friends in the Caribbean and other places. This will never happen. But in the UK, it happens. So you're very, very fortunate to be living here and have an MRI prostate. I tell you, my family there in Barbados ain't getting an MRI prostate on the public health system. Ain't happening. We have that ability. You will not have a biopsy of your prostate without that MRI happening. And when that MRI happens, you should know what your score is. Your score being 4 and 5 suggests something. Get a biopsy. Your score being 1 or 2, very, very low likelihood of anything happening. And if someone poses a biopsy to you, you must ask them why. My score is 1 and 2 on the MRI. Why do you need a biopsy for? Pose it back to them. It's a two-way conversation. This picture is your prostate here, here, and here. So when I examine you, I might feel that area there that's abnormal. It's very, I know the picture is small, so just bear with me. But if we examine you here, I can't feel nothing. And the MRI scan shows me it was in a different location to where I would examine and find 70% of cancer. So MRI is really changing everything. We're picking up a lot of tumors that probably would not be picked up. So MRI scan, non-invasive, no radiation. It's just magnetic field. The biggest thing is if you're claustrophobic, you might not like it. You go sit down, put some headphones on and listen to some cool music for 10, 15 minutes while they scan you. Doesn't hurt. There's no injection. But it can be uncomfortable for some people. And if you're claustrophobic, then we can make some arrangements and play some different music. But this is the biopsy here. Okay? Sorry. Make it lighthearted. Everyone's very serious. The biopsy. Yeah, the biopsy is not easy because any biopsy anywhere is sensitive, but biopsy down there, of course, would be very sensitive. So we do this under local anesthetic in my practice. But if man's just, can't handle, it's fine. We'll book you for a general anesthetic, but I can't book every single patient for general anesthetic. The system will be overloaded. Okay. However, local anesthetic is tolerated by probably about 90%, 95% of my patients. And we're doing a biopsy, not traditional way, which other places, other countries still do, the traditional way, passing needles through the back passage to biopsy your prostate. The high risk of infection, we do it differently. We avoid that completely, and the infection risk is less. Prostate cancer, if it's diagnosed, any cancer is diagnosed, would rock anyone's world, rock your family's world, obviously. And don't think that doctors are being robotic about it. When we tell you the support is always there, you should have a clinical nurse specialist to support you. You really should. And all options should be discussed with you at length, all options. Some patients come in with paperwork from Dr. Google. It's fine. We can talk about it. UK is a leader, though, in research and driving change because that simple thing, that MRI, available to everybody. Other places, big countries, US, MRI not available to everybody. Depends on what insurance you have. Imagine. UK is renowned for not over-treating low-risk cancer. So we actively survey patients who have low-risk cancer. Next slide, please. We wouldn't want to treat you. We'll just watch you. PSA number, maybe another MRI scan. So we're very good at surveying because we got MRI to help us. So I was asked before I started to really spend time on this Gleason score because it's important that men recognize if you're diagnosed with cancer, you should know what your Gleason score number is. It ranges from 6 to 10. 6 is low risk. Should be on surveillance. If you hear 6, you should say, great, I got the low risk fella. If it's a 7, there are different 7s. There's the lion 7. We need to tackle that. Or there's the little cat 7. And then you can watch that as well. Okay? Active surveillance, you can check your blood test every 3 to 6 months. Get an MRI scan. Avoid the treatment and avoid the side effects. And there's good evidence, next slide, that patients survive this active surveillance in the long term without any detriment to their health. Surveillance. Check the PS every few months. Check the MRI. Avoid treatment. It's a really good tool. The next slide will show you some studies that took place in very big hospitals in the US. know if you're familiar with Memorial Sloan Kettering in New York, John Hopkins, you heard of these big hospitals in the US. They've accrued up to 4,000, 5,000 patients and said in surveillance, the risk of death or spread is less than 1%. Small, very small number when you think about thousands upon hundreds of thousands of patients. Next slide, please. But then if you get a different number, if you get a Lion Gleason 7, or you get a Gleason 8 and above prostate cancer, you should be talking about treatment with your doctor. They should be talking about treatment with you. Next slide. Treatment is always dictated by whether it is just in the prostate or if it's spread. You can imagine the two different scenarios. If it's spread, it's different. But if it's in the prostate, then what me and colleagues do, guys, is remove the prostate. And again, I can spend as much time as you want on that. Talk all day about that if you want. In the UK, not more than 90% of the prostate removal surgery is done with the robot, which means it's just a fancy way of doing minimal invasive surgery, less impact on you. You can go home the next day, back to your family, back to your friends, back to work in about 2 weeks, versus the traditional open cut, which really kept people in hospital for a lot longer and really slowed down their recovery. Next slide. Not available in the Caribbean yet. But that said, it's caused a lot of benefits for patients because it's less impactful. You see this drawing? Sorry again. This prostate here with these little yellow fibers, these are your nerves. You see how close they are to your prostate? They're like the skin of an onion. They're on the outside. So when you operate on it, you've got to... You ever peeled an onion before? You've got to be very delicate. Sometimes it comes off intact, right? So if the cancer propagates and goes through the outside of the skin, the onion, then you have to take all the skin, right? Not trying to make you surgeons here, but you understand what I'm trying to give you a scenario about. So then the nerves are impacted. Obviously, next slide, that will have repercussions for your ability to have erections. And that's life-changing. And I know that. Because we have successes and we have half successes and we have failures with regard to erections recovery. Next slide. I was going to project that video of just an example of what it looks like, but I think the most important thing is you should recognize that a prostate being removed will have impact on your erections. They won't be the same, but we can help you recover them. It will be a journey of medication, of lots of strategies, tablets, even injections if you're very keen to hurry up. Radical radiotherapy, so radiation treatment. Radiation treatment is focused X-ray beams on the prostate. You avoid surgery. So that's another option. That causes some side effects. Slightly different to surgery in that your bladder and bowel can take a hit from the radiation and you're going to the toilet all the time. It can be a bit distressing. Very, very low risk, but not zero, of you developing a second cancer in your bowel or your bladder. So for men who are younger, who have longer lifespans, we tend to favor surgery versus men who are slightly older, then we could offer more radiation treatment as an option. But both are on the table to be discussed if you have prostate cancer that needs treatment. Next slide. If I'm going too fast, just let me know. Radiation treatment, yeah. I work very closely with the radiation doctors. That's a different field. But a new modality, some of you may or may not have heard of, focal therapy for the prostate. You just look at one area based on the MRI and you freeze it or you heat it, and then you leave everything intact. Becoming very popular now. Colleagues in Charing Cross and Imperial are pioneering focal therapy. It has less impact on your bowel and your bladder from radiation. It has less impact on your nerves after the prostate is removed because you're just applying energy to one little quarter of the prostate. Less invasive. but you're going to need to come back and get biopsies. And I think it's a new kid on the block. Give it some time. But the first set of biopsies have found cancer can sometimes persist in as much as 1 out of 3 patients. So for me, I don't do it. But there's some hospitals who will offer it in the investigation mode, and that's fine. You can have a discussion if you so wish. I don't do it. My practice is all about focus on what I would do in a setting that's a little different in the Caribbean. But that's just me. That's my personal practice. So focal therapy, this is an imperial slide. They won't mind that I've used it. Radical surgery here, radiotherapy, focal therapy. The impact on your erections is less with focal therapy, 5 to 15%. Surgery and radiotherapy up to 50%. See, the numbers don't lie. But the treatment of cancer, again, that's called salvage, is highest with focal therapy. You have to decide what's important. Is treating the cancer one time, getting it done important? Preserving the erections over the cancer treatment? It's a discussion. Every person is different. I will not put one size fits all in this discussion. And it's a discussion with the partners too. That's really important. Next slide. But I think once you grab hold of those things, that's pretty much prostate cancer diagnosis, treatment, and the side effects all bundled up. Next slide. This is a slide that's showing that most urology doctors in the country don't think screening is ready for a national rollout. 84% of urology doctors don't think that screening is ready for a national rollout. When you have figures like that. 16-year follow-up of European randomized screening. So randomizing is a really good way of looking at research and comparing two groups. Next slide. So the Europeans looked at 16 years of patients with prostate cancer, patients who were screened, patients who were not screened, and looked at how they did. Next slide. And the results were drum effect. 48% of risk reduction for mortality for PSA screening. 25% risk reduction for mortality for PSA screening. PSA screening should be done, in my opinion. Next slide. You can have all these slides if you wish. Please do share it. Yeah. Very happy for you guys to share it because I appreciate the vision. It's not the best. I'm struggling as well. Maybe that's my site that needs to be. Next slide there. And breast cancer. So, breast cancer, very, very important public health topic as well. I don't know if women just really, really look out for the signs early, but they present a lot faster than the men do, right? 233 to 746 women need a mammogram to save one life. A mammogram is that ultrasound of the breast tissue to save one life. For men, it's about the same. 570 men would need one PSA blood test to save one life. But yet mammograms are recommended for screening, but PSAs are not. So why are our men being let down? Okay. But it's not for me to stand up high and talk about it. It's you, it's the community that need to stand up as well. And I'll be there to back you.
Can I just say,
please do.
Can I just say that actually we are going to be speaking to Gussie in a while, and that is actually something that we've been talking about for many years, because we're talking about breast cancer and women get the call to go and have a regular check. They also get the check to go and have the procedure for ovarian cancer, but men do not get a letter here in the UK that says, come and have your prostate checked. I don't know, is that something that happens elsewhere? Are reminders given?
Yes, it's great that you asked that question because that slide speaks to it. The European Commission said in September last year there should be a stepwise approach to screening programs for prostate cancer. This is rock the European continent. It's the first time they've said recommend screening for prostate cancer. Of course, we're not part of the European Commission statement anymore.
You know, you were saying about the decision. Now, you're saying that we can do something, but we can only go so far. But the final decision is made by above us.
Above me too.
I know. So for us to say that we're going to come together and do X, Y, Z, it still might not make that much. Well, it will make a decision, but it's not going to make that much because the final decision is made above that. You know, because you see that 1 in 4 is very important. So now, if we go out there and say that we're going to do that and test for everybody, they wouldn't be able to cope with that. Because I've gone out there and I've spoken to many of my friends out there right now since I was diagnosed with the prostate cancer, and I'm talking to some guys out there, right? And I'm saying to them, look, what's your PSA? And one of my friends said to me, boy, Gus, mine's 7 and 8. So I said, 7 or 8. So what you doing? He said, boy, Gus, I'm just rolling with this. I said, you can't just roll with this thing. And this is the attitude that we have right now. So I'll talk more about that a bit later on anyway. But yeah. But you can, yeah. So.
I understand the passion behind it. Yeah, if 45-year-old PSA 400, not interested in tackling it. You know, that gets to my soul. But anyway, next slide. This was published in the UK. 15 years looking at one group who had let's just watch it. One group who had surgery, one group who had radiation treatment. And they compared the outcomes 15 years later. And they said, look, the survival was high irrespective of treatment. But the men who didn't have treatment had higher spread, metastases, they call it. And the men who died of prostate cancer, they couldn't identify which was going to be those men versus the ones who lived with it with metastases. The long survival of prostate cancer, the slow growing rate of prostate cancer was as such that it does not support the population testing for early detection. This was led by colleagues in Oxford. You know how many patients they had who were Black? Let's just say they didn't include any centers in London in that study. How can that be applicable to our community? You got to question everything, and people may look at this and question me. What are you saying? But someone's got to say it. My thoughts on Protect are 2023, we've got MRI. We got MRI. We got PSMA to look for spread, which is a really, really very important scan, but I won't go into it for time. In 2023, we've got ways to lessen the insults of prostate removal, the robot, the technology. All of this is developing because we don't want to give you side effects. Even radiation treatment, I talked about the bowel and the bladder being irritated. People are putting now gels around the prostate to stop the impact of the radiation. Focal therapy. We need studies that compare ethnicity. Because how can you have 1 in 12, 8, and 1 in 4 and not have comparative ethnicity studies? And then proclaim studies that don't even include London, that screening is not the way to go. 16% of men can present with metastatic disease on the first time. 16%. Yeah. Probably one man in here can present if they never bothered to get a PSA check. with spread. Next slide. I'm ending now. You'll be relieved to know. Because this is all food for thought. I'm here to speak at any time. And Kevin knows how to reach me. But it's just questions that I'm just posing to you. Questions you got to ask yourself. Screening is important. I believe that. Family history and your ethnicity should be a leading point to get screened, particularly earlier. Treatment is active surveillance. That is a treatment or the intervention. And I think the future with technology, such as MRI, is going to take us to a new stratosphere. And the thing is, we need to speak to GPs because GPs sometimes, I don't think, may not have a grasp. They've got to do so much. I know they've got to do so much, and they do so much work. But MRI is really, we don't biopsy everybody now. The PSA high and the MRI normal, I ain't going to biopsy you. Back to your GP. And I'll give you a number to get checked. That's how you reach me. And the last slide was that emblem there. How are you doing? Nobody knows the emblem up there.
No.
Thank you. Thank you.
What is it?
Next slide. Next slide.
Oh,
UE. University of the West Indies.
okay.
Right? The next slide come will just kind of, I'll leave it up there. But Kevin, thanks for inviting me again. Yeah. Thank you.
Thank you. Don't go just yet, because wasn't that a wealth of information? That was loads to digest. Dr. Jonathan has said that you can contact him. His details are there. But it means, though, that there's lots for us to do, whether we're male or female, because often the female will notice some things in their partner that the partner may not notice themselves, and vice versa. Also, because we've spoken about the fact that there's a relationship between breast cancer and prostate cancer. So the work is for all of us to do collectively. So are there any questions from the floor? Okay, we'll take you first. Thank you.
Right. Good evening. I see you all advertising the profile behind you. Now, question asks, I went to my GP 2 months back about having my prostate check. They sent me for we call it the PSA blood test. That hasn't come back to me yet. I'm doing a follow-up to ask them to do an internal check. And the last thing he said to me that the internal check, he will not recommend it because it can aggravate it. So I hearing something different from today, and I hearing something different from our GP. So which way should I go?
Yeah, no, I can't tell.
I would say the PSA blood test you should know. This is 2 months ago, you said?
Yeah.
Well, you should know your PSA number. And then if the PSA number is high, you come and see the urologist at your local hospital, and they can do the internal exam. GPs can do it. That's fine as well. But if it's high, they should send you to the specialists as well. It can slightly elevate it, but there's some controversies about that. They've looked at men who cycle very vigorously versus men who don't, and the PSA changes were not that different. But it can elevate it, and then people go, it's falsely elevated. But your PSA 2 months ago didn't have that effect, so you should know that number.
Just quickly before I go to Gussie, do you know you were saying in the beginning about the fact that there are so many different reasons, like cycling or flight, long haul, that make a difference to your reading? Does that mean then that your first reading wouldn't necessarily be something to worry about? If it was higher, would they kind of do some history around why it might have been that high, if that makes sense?
So your first reading, and you haven't done any long haul flights, you haven't had any irritation, should just be a true reading. But if it's high and you've had some of these things, you admit to, whether it was intercourse the night before or something like that, then your GP should repeat it, or they may send you straight to me, and then I often repeat it again anyway. And I always repeat. I always want two. I don't want one. I don't go on one and take patients down that road without a second.
No, but just going back on what that gentleman just said about the doctors and the PSA. I think the doctors should do a lot more because not by what you're just saying, because I've spoken to a lot of people about going to the doctors, and when they've gone to the doctors and they've asked for a PSA test, the doctors are asking them, why do you want a PSA test? Now why are they asking you that? If you're if you are a certain age and you're trying to tell the doctor, listen, I've got a history of this, then they've got to do that. But some doctors don't do that. They shouldn't ask you, why do you want a PSA?
I think this risk checker is new and pretty powerful because Prostate Cancer UK is a very big charity. It's a free risk checker. Ask you questions about family history, ethnicity, and with that, saying we would recommend a PSA blood test. I think going to your GP with that is quite a powerful thing. They'd be very hard pressed to, I suppose, challenge you on that. But because there's no national screening program, that's the thing, and that's why I always push for it. But
So we had one here first, and then we'll go to the lady.
Hi, thanks for the presentation. It was really useful. I have a friend who's had PSA levels around 6, numerous blood tests. It remains at 6. He's had 2 biopsies and they say it's clear. However, they still want to keep monitoring the bloods. Why is this?
Could be multifactorial. How old is your friend? Do they have family history? Ethnicity? I think they just maybe they have an inclination that something may develop in the future, but I don't think that should stop them from this perhaps getting ownership being taken by their GP to monitor the PSA every year and then get them back into you if the PSA went to a certain threshold. You see, for me, when I look at the MRI scan, if it's normal, because this friend of yours should have had an MRI scan, if it's normal and the PSA is 6, then I work out a number. And then if it goes across that number, say it's 7.5, you come back to me. Now, if they've had 2 biopsies, that's double the surety that nothing is there. So I would say his threshold for PSA needs to be passed on to the GP, and you need to come back to me. I'm not sure why the hospital is still following them up. But sometimes they're junior doctors and they may not have the confidence, in which case they need to speak to their consultant.
First of all, I just want to say thank you for the talk. It was really informal. I think you mentioned the statistics was 1 in 8 for white people, 1 in 12 for Asian, and 1 in 4 for Black, which is alarmingly high. And I'm from the Caribbean. I have family living in the Caribbean, just like I'm sure a lot of people do here. Do you have any information on like how we're progressing in terms of we're making a lot of advances in the UK? Are we sharing it with the Caribbean because there's so many Black people there?
I think that's a fantastic question. Where's the progress in the Caribbean? I've just touched base with a colleague from Jamaica. He practices in Cornwall. I actually invited him here. I was hoping he was going to surprise me and walk through the door. Must be busy. And he shares with me his experiences, the public system and the private system. He works in the public system, but it's underfunded. And a lot of the technology that he wants to bring to his practice, he has to introduce from out of his own pocket, with the understanding that it will be reciprocated by the government in the long term. But it doesn't happen. It's heartbreaking, the stories he has to tell me, but I think we are a long way off. And I think that any major changes, particularly what I'm talking about, MRI, robotics, has to be through philanthropic methods right now. But hopefully one day, the government will invest as much as it's investing in the NHS, despite all the strikes. You still get good service, I would say.
Thank you. That's a good question.
Thank you so much, Doc. I just would like to understand what are some of the reasons why there is no national screening, especially in the case where you have the incidence of prostate cancer is so high among black men.
It's a really good question. I do ask myself that, but I don't think the data that I've just shown you, which was not very rich with ethnically diverse patients in the studies, that has to be said, showed that there was a benefit in terms of overall survival. They thought it was so slow growing that a man may succumb to some other illness above the belt rather than below the belt. And so putting all of these resources into screening was not going to impact the life of a man. But then, this figure shows that, men have different biology. Ethnicity groups have different biology, and you have to take that into account. But there is some work, I have to say, positively being looked at. I think there's a lot of inward reflection as to why there is no national screening program. The Europeans have just approved it in September 2022. Now it's September 2023. My hope is that in the UK, it's going to turn around and they're going to recommend it. But I don't know why. I don't have a better answer than that, I'm afraid.
That's interesting because we've been working on that for so many years. That idea, it just bypasses me as to why that isn't just standard. So,
Yeah.
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 We'll go to Hassan and then we've got
One of the questions, it's not really a question, but thank you very much for the talk as well.
You're welcome.
Yeah. But it's about how do we get government legislation, because these things affect a community of people. Yes. And if this community of people is not important, you know what I mean, or as important, how do we go about doing legislation? Because that's some of the things that I have to work on because of my situation with my BRCA gene, because I have the gene for cancer, and working around things, you know what I mean? Because it's legislation. This is the only way we'll make changes that happens. I mean, and as well as us as Caribbean people and African people, we have to also know, put ourselves forward for different types of trials that's available. So then more information about us and how it works specifically for us, it can be recognized. And then, you know what I mean, the who's would have information and then have that to say, well, oh, I can see this now. I can see this. I can really see this because it's showing, we're presenting and putting ourselves forward to show this information, So I believe, I mean, I don't know if there's trials running, within this whole sort of things with when it comes to prostate cancer, different things like that, because a lot of us, we need to change, we need to make that change. And that's the only way forward, I think, you know what I mean, doing it that way and then putting it towards legislation, asking Macmillan, asking Cancer Research to put these things forward, because it's important. It's a group of people that will continue to go. I mean, it will just become 1 and 2 just now and 1 and 1, you know what I mean? Because no changes.
And then we'll go to so locally in the borough of Brent, I've just been appointed literally last week Tuesday, so it's very, very new, to take up that mantle, actually, because there's lots of research on how a number of conditions affect or impact the marginalized community of which we are a part of, the African Caribbean community, how we receive services when we get our diagnosis in compared to our white counterparts. So for example, women are going to get a kind of a later diagnosis, which means if your diagnosis is later, then there's less chance of you having that early intervention if you've passed a certain phase. So there is going to be some information, there is going to be some work around communicating and connecting with those who are either directly impacted by it, or I think Dr. Jonathan mentioned that it doesn't just impact you, it impacts your entire family. So we're going to be looking at how this impacts us. I'm just the person that's doing it in Brent. There are other boroughs that are doing that, and Gussie and I are going to speak some more about what's happening here locally. But I don't know if you had a different answer.
No, I think engagement with political figures as well is important, how they legislate change. kind of takes you out the realm of my day-to-day practice. But I think going through MPs, mayor, seeing how you can legislate change would be a real start, particularly in areas that are rich with African and Caribbean patients. And having figures like this, I mean, it just states the obvious. And Prostate Cancer UK as well, with their advertisement and logos, need to be also pressed as to what they can do to help also, you know, because they're charities and they draw a lot of publicity, which is good.
Cool. So we're going to go to Councillor Robert Johnson. Can you just give her a round of applause? And then we have an online question.
Okay, I'm really glad I'm here. I've actually been.
Do you want to come to the front?
Yeah.
Yeah.
I was actually subject to another prostate cancer talk last week, and it was on a national level. Right, so they are pushing also for a national screening program. So I think that what we can do, because I think we also can influence the agenda, in that we actually speak to our doctors, speak to our MPs, and try to get a petition raised in Parliament in order to actually push for a screening program. And I think that's the only way it's going to happen. Yes, money is going to be a factor, but if so many people all around the country push for the same thing, it will happen. Okay, so I think that's all I really wanted to say. Okay.
Thank you very much. Thank you, thank you. Okay, so we're going to be wrapping up. Are there any final questions
Online
before
question?
we move on? Just the one on the line. Can you read that, Tia?
So someone's asking, how does the NHS support men diagnosed with prostate cancer through the mental challenges faced upon a positive diagnosis?
I think that's a really, really important question as well. So there's Macmillan support. There should be on-staff psychology as well. I think identifying it early, and it doesn't have to be when you have a diagnosis. It could be just when you present with a PSA that's high and you're there with your family and everyone is very emotionally charged situation that you could have a diagnosis of cancer. And I think if the doctor or the nurse has a suspicion that they're not going to cope well with it, then you can initiate a referral via Macmillan, via nurse specialist to local psychology and psychiatry support. That is there, at least in my patch, and it should be with every hospital, because cancer is not only physically impactful, it is mentally as well. Yeah, great question.
Brilliant. Thank you for that question online. So we're going to wrap up with this section now. Any more? Going, go on, guys. Put your hands together for Jonathan Noel. Wasn't he absolutely awesome? So lots of information there, some great questions, and lots for us to think about. And it's everybody's job to do something about cancer. So thank you, Dr. Jonathan. So up next is a very dear friend and somebody who, interestingly, we have both been working for a number of years, in particular with Errol McKellar, who's often here at Main Culture, around raising awareness in prostate cancer. We've also spoken about the very same thing, about the legislations and how we can make the changes. So I want you now to welcome, warmly welcome to the stage, Gussie. Bring Gussie to the stage.
Well, thank you. Thank you very much.
Good afternoon. Good afternoon.
Good
So,
afternoon.
Gussie, you and I, for a number of years now, have been working in the area of trying to support Errol McKellar and those affected by prostate cancer. Why did you first get involved in that?
No, because when Errol's my cousin, by the way, when he was first diagnosed, he gave me a call and he was telling me about what he was going through and how he went to the doctors and how it came about. And when he went through what he was going through, it made me think of trying to support in what way that I could. And moving it forward, when I was diagnosed with prostate cancer, a bit of background of myself. I'm 62, got two boys, one 42 and one 37. And when Errol told me about his problem, we decided to try and do something in terms of like raising awareness and stuff like that.
Sure.
And for the last 15 or 20 odd years. We'll
Mm.
be trying to put things together. But when I was diagnosed, I mean, I first found out when my doctor called me and said to me, Mr. Young, can I come in and see him? So I said, okay, I'll come in and see.
So was that just a random call? Just can you come in, or had you been in and done anything?
No, because every year I always have my
Mm.
my MOT test.
Okay.
And he gave me a call and said to me, can I come in and see him? So I went in and saw him. And he said to me that my PSA level was high. So I said to him, well, how high is it? So he said to me it was 3.8. So he said to me, just to be on the safe side, can I go and have a MRI scan?
Sure.
So I went to have the scan, and the scan showed up something there,
Mhm.
but he couldn't sort of like say to me exactly what it was. It was a tumor, but how large it was and how small it was, he couldn't tell me. So he said to me on the back of that, do I want to wait 6 months or have a biopsy? So I looked at him and I said to him, look, I'm here now.
Yeah.
Let me just have the biopsy now.
How long? Talking about that, how long had you waited? So you've had the MRI. How long had you waited to get the results? Was it a long time? Was it a couple of weeks, days? How long were you waiting?
No, because because as far as I was concerned, as soon as I found out, when I actually found out that I had so when he told me
Mhm.
that I had the tumor, I went down in my car. I just sat in my car for about 45 minutes in my car,
Mm.
and tears were coming to my eyes. I thought to myself, after campaigning for so long,
Yeah.
now look at this now. And it took me a while to compose myself to even drive my car away from the place.
Mm.
And
So had you gone on your own?
Yeah,
Yeah.
yeah, because I didn't think it was going to be what it was.
Mm.
But
Because I guess that's the irony, isn't it? That you were campaigning for such a long time and talking to people, and you're saying that actually you're one of the people that does an MOT. How many people in here, as a show of hands, do their MOT? Brilliant.
that's the question
the
that I was
key
going to
thing.
ask as well. But the thing is, I would like to ask the men inside here, when was the last time you had your PSA test done? 6 months
6
ago?
months.
2 months? A year ago? 4 months? 3 months? Okay. Well, it seems like a lot of you are on point with this, because if I was to go and ask some of my friends out on the road now, they're telling me they haven't been to a doctor for 2 or 3 years,
Mm.
right? And particularly one person said to me that his PSA was 7, and one said he was 10 or something. Guys,
Wow.
what are you guys doing? And all they're saying to me, boy, guys, I'm just gonna go with the plan. I'm just gonna. There's no plan.
There's no just go with.
No, because
Yeah.
because you see this thing here, this is like a common cold for us right now.
Mm.
That's what it's turned into right now.
Yeah.
A common cold for us right now. But
So Gussie, you've had the MRI. You've been to the GP. He's told you what it is, or at least what he thinks it is. You've sat in your car for 40 minutes. What are the things that are going through your mind at that time? Why were you there for 40 minutes?
well, I just had to think about everything. Just flashed the whole. When the word cancer comes up, everything flashes across in your
Mm.
mind, in your head. And the first thing I thought, something, let me just phone my brother. So I
Mm.
phoned him. I said, listen, this is what it is. Go get yourself tested. It's the first thing I done.
Yeah.
And then I found my wife and I told her. And then
Were you still in the car while you were
I'm
doing
still
all
in the
this?
car. I'm still. I haven't even moved yet.
Yeah.
I'm still in the car. So I found my wife and I told her. She broke down. I said, listen, don't break down. We're gonna start me off again.
Mm.
Right. So once I finally got myself composed, I drove off, and I was talking to a few people, and I said, boy, because I think after
Did you call Errol? By
Yeah,
any chance?
yeah. And Errol Errol said to me, listen, don't worry about nothing. I've gone through it, and we're gonna work together. And that's how we're working.
And your
But
sons? What about your sons? You
my
have two
sons,
sons.
the same thing I said to my boys. But the thing is, I didn't want anyone to worry too much, because the hardest thing for me was to get my head around the whole thing, get the mindset
Sure.
right.
Mm.
So once I got my mindset right, I knew where I wanted to go. So after I spoke to my brother Errol, my wife, the only thing in my mind now was to just raise the awareness now for men in general now.
Because that's brilliant, because Gussie is very well known in this area for his work in the community. especially around radio and promotion and all the great work he does with young people and football. So you're quite a well-known person. So for you now then to have to tell your story to everybody, what was that like for you?
It wasn't easy, but I think once I got my mindset right, because the key thing is the mindset. If your mind's not right, then you can't portray what you really want to say to anybody.
Sure.
So I got the mind right, and I thought, you know something, I'm not going to just keep this to myself. Which some people are saying, boy, why do you want to share it? So I say, what do you mean, why do I want to share it? This is not just about me. It's about men in general. So that even pushed me more further to try and do what I'm doing.
Because I don't know if you'd agree, Gussie, but in this community, for some reason, we don't really say, sometimes we don't even say the word. We keep it a secret as if it's something that we have done to ourselves. We don't, they got the big C, they might say, or don't tell anybody that's what you've got. But what you're doing is absolutely right, because when we share, then we inform others. When we share, Ronald was here earlier talking about vulnerability. We can share what's happening for us so that other people know and learn and understand. So I commend you on doing that, because it is important for you to do that. So thank you for doing that. So you had an event in the Hub in Stonebridge.
Yeah.
Tell us about that.
That event, again, it was just to raise the awareness of prostate cancer for men and about men. And I wasn't really expecting a lot of people to come down because it was the first one. And on the day we had about 60, 70 men come in there.
It was very, very well attended.
On the back of the first one there. And within that audience there was a lady that was in there. She came in and I saw her coming. I knew her, but I haven't seen her for a little while. And she said to me, Gus, I just want to come and support this. So she came in and she sat down. She never said a word until we actually was going to finish up. And then she said, can she say something? So I said, yeah. And what she said to me was that she's one of 7, okay? 3 sisters and 4 brothers. And all 7 had cancer.
Wow.
All 7. And I looked at her and I thought, look at this. And she broke down herself. And at the time we had people there that could support her and stuff like that. So I spoke to her, it was about 2 weeks ago, and she's getting through what she needs to get through. But this is the situation out there. But out of the 70 people that came there, right? These are different people that just heard about the event.
Sure.
But the people I really want to come, the people out on the road, the ones that's in the dances, the ones that's all around, those are the ones I want to, because out of those people, I can guarantee you.
For sure. Especially with that figure.
Right. A lot of them are afraid to even go to the doctors. And, when I was going to have the biopsy, right, the guy said to me, when he said to me, either I wait 6 months to have the biopsy, I said, listen, I'm going to have the biopsy now.
Sure.
So when I said that, there was another guy that was beside me, and he looked at me, and so I said to him, well, why are you looking at me? He goes to me, you're the first one that's actually said yes first without considering it. Every time that word biopsy comes up, they get up and they walk out the door. So this is why we're trying to break this thing now, where we look at this thing in a different way, because the treatment is different now. It's all different now. And we're trying to change the minds of men now that it's not the way it used to be.
Gussie, do you think that some of the work that you've done for the 15 years and the fact that you've spent time with Errol and receiving the awareness, do you think that helped you in some way?
It's helped me a great deal, because it's when I first found out, I didn't know too much about it, but because now I've got the tumor. But let me just say that from my part with the doctors and going through, my one was caught early. Mine was caught early, and the consultant was showing you some stuff which was up on there, and I was on active surveillance for every 3 months doing my PSA, getting that done, and the levels were.
Was that since the diagnosis?
Yeah, this was 2 years ago. and getting it done every 3 months. And now I'm on active surveillance again, but getting it done every 6 months. I've got my next PSA to be done in October.
Mm.
But one thing that I want to say, which I wanted to ask the consultant as well, that not many of them talk about the dietary side of things, how we can deal with it properly. Because I don't think they really, I don't mean it in a bad way. I don't
Sure.
think anyone really knows how to deal with this level and why it's affecting us the way it is.
Because interesting, you look really well.
So yeah, but
So
listen,
people will say, "Oh, you look well,"
right? But
so
inside
then,
is a different thing,
yeah.
right? And this is, you know, this is what I keep saying to people all of the time, that you can look at somebody outside and say he looks good, looks fine, but behind all of that, there's a lot of things happening, you know. And one thing that's really kept my PSA down, and I'm hoping that when I get back again, that it's still low, is people's all been telling me about changing it to the alkaline diet.
Sure.
And I've been drinking some alkaline water every single day, and that's been bringing it down. So you know, so that's
Have
helped.
there been any other lifestyle changes? Because you do a lot of sport anyway, right? Have there been any other things you've changed? You're doing alkaline water. What else has changed for you since this diagnosis?
I'm just trying to just change my dietary slowly, because I think because mine was caught early, I'm still functional in every way to be doing what I'm doing. And also the hardest thing for me is really just to change the diet.
Sure.
and try and find a way to try and cut out certain things and try and do things in a different way.
Absolutely.
But the key thing that I want to say to most men out there, get the test done. But I know this gentleman was saying about his PSA, he didn't get the results. Chase them up, because they're not going to come back to you.
Don't give up. Don't give up.
Because you know, because if you don't chase it up, it will just sit there, and this concerns you and your health.
Absolutely.
So make sure you chase them up 24/7 about that. Yeah.
So Gussie, let's talk about the man van.
The man van.
What's the man van all about?
The man van is something which is going to be introduced in the next few weeks. Alternative weekends, Monday, Tuesday, Wednesday, from 10 until 6, where the man van's out there. We can go on there and get your blood test done, the PSA blood test done, and go on there. But I think they've put an age on it, which you've got to be 45 or so.
Well, there are some leaflets outside.
So,
we're working on making some changes to the leaflet so it's culturally specific and relevant. But in the meantime, there are some leaflets outside. And this is a conversation that was held between myself, Gussie, and Errol, because as we mentioned before, that women can go to Tesco car park or IKEA car park, and there'll be a portable van there where you can go and have your checks. And we were asking for the same for the PSA. So the council are now supporting that in this borough. So make sure you grab a leaflet and find out where the man van is going to be. I think it's going to be in Stonebridge.
the man
soon,
van,
isn't
yeah,
it?
it's going to be in Bridge Park complex.
Yeah.
So you know, so it's going to be there. For me, I think it's a good thing. It's, you know, it's a start, right? So, you know, for the people out there that don't want to go to the doctors, the van is there for you, and just go on there, just get tested. You know?
Yeah, because you know, the pastor was saying earlier on about the fact that it's uncomfortable. Let's be uncomfortable for 5 minutes or 10 minutes or for a couple of hours, instead of being that statistic that is 1 in 4. So if you can have a better quality of life by simply going to your GP, then let's encourage people to do it. Because Gussie is saying that fortunately for him, he has a regular MOT, and some of you are saying the same. Fortunately for him, his has been checked early, but nonetheless, he still has what he has, and he's now trying to change his life and continuing to spread the word and raise some awareness. Was there something else you were going to say?
But also, you see, like when you go to the doctors, when you go for your check, they will just give you the standard check, okay? But for the men who are a certain age, you ask for the PSA, and if they tell you, they can't say no to you about the PSA. Once you're a certain age, you tell them that you've got history, they've got to make sure that you have that PSA.
And
because
that's
because there was a doctor that was at one of my meetings there, and she's working very hard now to try and get that as a standard thing. You know, so hopefully that can be done.
Yeah, but stay tuned in because Gussie works very close. Was it Sarah in Brent?
Yes,
Spoke
Sarah,
very
yeah,
fondly
yeah,
of you at a
yeah,
recent
yeah,
meeting.
yeah.
Gussie's already started the trend of doing some work here in Brent, and I've now joined the team on an official level. So we're looking forward to doing some work. Is there any questions to Gussie before we hand over? Alison, did you have one?
You know, when we speak about prostate cancer, you know, it comes with a certain age or reference to if you have history, you know, but when you talk to a 16-year-old boy or 14-year-old or even like a 25, 28-year-old man, and you say prostate, they'll be like, oh, what is that? You know what I mean? How do we bridge that gap? Because you know it's about bridging these gaps from very young, so it's understood that this is situations that come up for people within the Caribbean, within Africa. You know what I mean? How do we make that a topic when it comes to young Caribbean and African boys? Because again, you know what I mean? We are promoting this to a certain group, you know, a certain level of man, you know what I mean? But what about the younger man? You know what I mean? That younger person who has no idea.
There's lots of information out there, but again, meetings like this is a place where they can come. And going back from my experience, I mean, my parents didn't really talk about stuff like this, right? And I only found out probably about 2 or 3 years ago that my uncle had it. You see now, this is going back through history. So I never knew nothing about this until I had it now. So I'm sure that there's lots of people here now. If you check back your history, you'll find out, because parents, a lot of parents are very proud. They don't want to talk about stuff like this, but it should be spoken about. And this is what I said to my boys. You know, I said, listen, I'm going to tell you everything what's going on here, so it can be passed down the next generation and stuff like that.
That is important, because we should have these conversations. I've done conversations recently about menopause. Women aren't talking to their children, male and female, about menopause. There's so many different rites of passage that we should talk about anyway, and health is one of those things. We talk to them about how they conduct themselves at school. We talk to them about how they tie their shoelaces, how they cut their hair and keep themselves tidy. We should be talking about these conditions, whether we have them within our family or not, because there's always going to be a first person in the family to have it, to your knowledge. So we should make it commonplace to have these conversations with our daughters, with our sons, with our nieces, with our nephews. And so having these conversations here in these spaces is really, really important. Alison, hello, do you have a question? Lovely to see you.
I just wanted to ask, what did you think was the absolute fundamental reason why Black men are not interested or fear some of getting checked for PA? There's got to be something. And do you think it's anything to do with their sexuality? And
No. No, sorry, go on. Sorry.
No, well, what do you think is the fundamental reason why?
A lot of men feel that that they're going to be violated. That is the main thing, and this is the stigma that's been going around for years, and it's still here now. So this is the barrier that we're trying to break down now. We're trying to break this barrier down now, right? To try and make sure that that to try and say to them, listen, things are different now. Treatments are different now. Everything's different now. But the thing is, well, all we've got to do is go to the doctor, just get the blood test done, and then we can take it from there. Yeah, because you see, like when the hospital said to me that I've got to go and have the biopsy, right? Because I had one before, right? And one of them I was awake for, right? And the second one now, he said to me, no, I said to him, look, can I be awake for this one? And everyone was saying yes, yes, yes. So by the time I got to the hospital now, right, I said to the lady, did they pass it, the influence that I want to be awake for this one? She said yes. So I was in the gown, everything was there now. the surgeon came to me and he goes, Mr. Young, I understand that you want to be awake for this one. And I said to him, yeah. He said to me, to be fair, I don't think that that you were able to go through this being awake. So I looked at him and I said, listen, just knock me out. And that was it. But I understand all of that. But the only way that you can really find out, the men can only find out, is by having this. You know, and as I said before, I always bring it back to the women. I said, look how much things the women go through.
Absolutely. I was just going to say the same.
And just the one thing that you need to do for yourself, right? You know, so again, it's just a mindset, and out there right now, that's the word out there being violated, and we need to break that. We need to knock it down, and teach them to understand now things are different now.
Absolutely, because for women, we give birth all the time. I won't even go into what that takes to do that. We have to have examinations. We have to go through the process of the breast examination, not just ourselves, but we have to go into this equivalent, what we're calling the male van. We have cervical smear tests. And so it really is about just doing that for that moment so that you're not the 1 in 4. Get it done, have it done. You don't have to have a video. You don't have to report back to your friends about what it's like. You just really need to get it done. Gussie, any final words or thoughts that you want to share before we say thank you so much?
Thanks for the invite here, because as I said, you know, events like this, it will bring out the men. But the only important thing that I want to say, this is to the ladies now, right? The men are stubborn. Right, they're stubborn. So now they might hide 1 or 2 letters and stuff like that regarding this thing, right? But what I'm saying to you now, go with him. Make sure because he might say, oh, I'm gonna go down there, but he does a detour, because I know someone that's done that, right? He says he's going there, he's done a detour, and up to them don't reach.
I love that. That is important, because support's important as well, isn't it?
Of course it is. And the ladies, please make sure, because again, I'm going to go back to another friend of mine again, right? His one was more severe than mine, and he was having a hard time just going through it. And he was married, and his wife thought it was a quick fix thing, right? It's not. Emotionally, it's not. Physically, it's not, right? So now they have split up now, right? And I spoke to him last week, because his boys plays football for me, and now he's having a problem seeing his boys now. And he said to me, Gus, you know something, I don't want to be around, and that's his mindset. You see, caused by this. So ladies, try to understand it from the man's point of view at the same time. Yeah,
that's important. It's hard to get the support, and also it's hard sometimes, Gussie, for the women to get in, because like you're saying, there's this blockage where it's difficult for us to get in. So I say to that, men, let us in, let us support, let us try and understand, let us try and offer whatever it is that we can offer. And to the women, I offer the support and go through. It takes tenacity. You got to sometimes and stick through and be committed, but be committed, because your emotional health is as important as your we needed some batteries. Your emotional health is as important as your physical health. So I'm going to do a quick wardrobe change now, where I fly over and get the batteries. But in the meantime, can you put your hands together and warmly say thank you to Gussie? Thank you. That was wonderful. So, guys, it is all about the prostate cancer. 1 in 4 Black men are impacted with prostate cancer, compared to our white counterparts of 1 in 12 and 1 in 8. Early diagnosis saves lives. Up next is somebody who has spoken here before, and she's back to speak to us again. But today she's going to be talking not just about her journey with cancer, but also about how it impacts her emotional health. So can you put your hands together now? Warmly welcome Hasna. So Hasna and I have had a couple of conversations. First here, as I said, I manage the Chalk Hill Community Radio Station, and we have a Brent Health Matters live radio show, and Hasna was one of the guests. And we've had a number of conversations, and I'm always empowered by your ability to talk about your journey. So thank you for being with us here again today. So Hasna, when were you first diagnosed with cancer, and tell us which cancer you were diagnosed with?
I was first diagnosed with breast cancer, ductal carcinoma in situ at stage 3. I was 29 and I just had my first son, well, no, my second son.
Yeah.
Yeah. So
And we were talking today, weren't we, about the length of time in the
yeah.
history?
So it's 2006. And sometimes for me, when I look at my life sometimes and I see 2006 when I'm going through medical reports and I see 2006 and then it's like, what? It's 2023. You know, I often think of how I made it, how I got through it. This is a lot of years, is nearly 20 years.
Wow. And we give thanks for that, though.
Yeah.
But I want to ask you, what was it that first raised your awareness of you having cancer? What happened for you?
I was breastfeeding and I felt a lump. And as a young person, I was 29, the GP, sort of brushed it off. Yeah, no, it's breastfeeding, but blah, blah, blah. I took it into my own hands, and which along this journey, you have to take things into your own hands. And sometimes,
What did you do when you say that? You took it into your, what did you do?
So I challenged my GP and I said to her, you are a woman, you know what I mean? Why are you not giving me what I'm asking for? I took them to court.
Wow.
Yes.
So you were asking for an examination, some treatment, investigation.
Yes.
Were they just saying no?
Yes, 6 months had passed.
Wow.
And I mean, with all of that, I have the BRCA gene. That's why I had the cancer from so young. And the system just didn't look at that.
And was that here in the UK?
Of course, it was here in the UK.
Wow.
They just bypassed it. So I then went to the GP and sort of fabricated a huge story about, I have pus in my breast and all sorts of things. And then they took me seriously there and they gave me a scan more or less straight away. And I was diagnosed with grade 3 breast cancer. And it could have been, it was 6 months. And the aggressiveness, now that I know the information on this type of cancer, that's 6 months time, that's where it grew, because it could have been at stage 1 when it presented itself.
That's pretty horrendous that we have to kind of, although you say fabricate, it was a real illness because you really had the illness.
Yes.
But the fact that you had to add some bits on so that you could be seen, that's pretty horrendous.
And
so what happened after that?
Well, after that, I was in a place of numbness for a long while, and in the place of, oh my God, this is what's happening. The doctor says this. I have to do this, that way. And I went through chemotherapy. I am a Rastafarian, so I lost my locks. That was a really big part of it for me. But I mean, like the treatments that I went through, so I had chemotherapy. And again, I had to challenge the system because the chemotherapy for me was too strong. And again, this is why sometimes within ethnicity, we have to know that the drugs don't work or work too hard or it's too much on our system. So I had to challenge my whole chemo board, and tell them that this has to be lessened. This dosage has to be lessened.
Who was supporting you to do all of this? Because we're talking about the fact that You're a mother of two. Was it two?
At
You're,
that
you're,
point.
you're quite young. You're in
Yeah.
your 20s.
Yeah.
You're learning about this. You're going through this as your own journey.
Yeah.
You're having to fabricate. You're now having to challenge. Who was supporting you to do this?
Well, I have a big family, you
Mm.
know, and I'm loved by a lot of people, you know, and I
Nice.
sort of grab people's energy. That's just one of my superpowers, you know, to me. And
I
I'm
love
able
that.
to gather people energy and know that everybody is fighting for me. In saying that, you know, I am a strong believer in the Most High God,
Mm.
and it's God above everything, you know.
Sure.
So
So your
he-
faith, your family,
yeah,
your way of living.
yes, and I mean, one of the things I often do too is I big up myself.
Oh,
you
good for
know.
you. Give her a round of applause, guys. Let's big her up. Let's help her to big up herself. I love that. She
Yeah.
big up herself. That's brilliant. I love that. We're bigging you up today.
Yeah.
And thank you for sharing your story. So tell us where you're at now. So you know the medication isn't right. You're losing your hair. You're having to fight. Tell us what next.
All right, so this is 2020, 2006, 2010. Because I have the BRCA gene, I then went into the other breast, having the cancer.
Wow.
Went into that side. Went into do a radical mastectomy, which is to remove my breasts.
Both.
Both. But it was a radical mastectomy with using my own muscle and tissue.
Hmm.
So it's called a DIEP mastectomy, where they take tissue and stomach muscles to create over your breasts
So did you have both your breasts moved in one surgery?
in one go.
Wow.
Yeah, in one go. I mean, I had a joke about myself, and I humor a lot of things about myself because it helps me to cope. And when I imagine myself without my breasts, I saw a selfie face,
Hmm.
you know, with eyes, and my belly as my nose, and because the
Oh, I
scar,
see.
because I have a scar.
So you've got an emoji body now. She's got an emoji body.
Right. And I have a scar from the surgery from side to side, you know, so that's the
That's
smile.
your smile.
Right. You know, so I mean, I spoke to the consultants and everything and asked them what it would look like. And that was another thing.
Mm.
Back in the day, 20 years ago,
As a young person.
there was nobody looking like me. There was no one looking young or even black.
Mm.
And I was like, but how do I see myself? How do I see someone like,
Sure.
you know, any sort of representation? So for me, I took it upon myself to start to speak from then, start to show pictures, because again, I did not know how it would look.
Mm.
You
So you
know.
showed pictures of your body. You shared
Yes, I
pictures of
do
your body.
share pictures of my body to a lot of women, you know, because it's and I do that on my platform because emotionally, yes, you go through this and it's like, okay, yeah, I have to do this because this is the medical side of things. But emotionally, there is nothing there behind. And when you can give someone a picture of your body for them to have an idea, it gives them sort of like a buzz in their head.
Do you know, I think that is super courageous because often women don't want to show their body just anyway.
Yeah.
But to do that for other people, guys, give Hasna a round of applause. That is absolutely phenomenal that you would do that, and very courageous. And how very thoughtful, actually, and considerate that you showing your levels of vulnerability would allow another person to kind of get some benefit from that. So thank you for doing that. So you've shared your body images. You've referred to your body as emoji, smiley emoji. I like that. That's really cool. Where are you at now? Where are we in the story now?
Right. So advancing to 2017, I was diagnosed again with metastasized cancer. Metastasized meaning it has gone into different parts of your body. And I have been living right now on clinical trials. So I have been living on 4 clinical trials. I'm at the Royal Marsden. This is my 4th one.
Wow.
This one has been working for the last 2.5 years. It has been good to me. You know, it has been very, very good to me, but it's not an easy road. It's sort of like I'm on a repeated cycle, you know. But this is where it comes to the emotional part of it, because for me, I know that that's my life.
Sure.
Nothing can change in that part of it. But I always think about different ways that I can be resilient, different ways that I can not feel all the fatigue or all the stress, you know. And sometimes in doing things like that, I do talks
Sure.
like this. And when I do talks like this, or if I happen to, because I mentor a lot of women as well too with breast cancer, it helps me because I know that I do have the BRCA gene.
Can I ask you though, just to be clear? So you've had the double mastectomy.
Yeah.
Does that mean that you are now free from cancer?
No.
Tell us about that.
Yeah, because I have the BRCA gene. The BRCA gene is the gene that, if you have it, you either get breast cancer or ovarian cancer. Very
So it
young.
stays within. You've just got that, and that's
yeah,
it.
it's just like, I mean, you have heart disease.
Okay.
Yeah, so it's a gene
Okay.
defect. I mean, there are different types of cancer, but the type that I have, it's the most aggressive triple negative breast cancer.
Wow.
And with that, I also have the gene. So I'm in a very high category of recurrence of cancer, life with cancer, you know, and this is why I live on trials.
What does your everyday kind of life kind of look like, feel like? Are there things that you have to do that perhaps other people don't do on a daily basis?
No, I live my life just as everyone else, I would believe, you know, to me. And the only thing that I think I do different is that I don't take on anything. I honestly, I swear, you know, it could be raining. And I know that the reason why I don't take it on is because here what? The path has already been set out
Sure.
for me. So I just present myself. You know, I mean, there are many days. I mean, I know I'm always smiling and, you know, telling jokes.
But do you have days where you're like, today's it's a tough day today?
Tough day?
Yeah.
It's not even tough, you know. I break down, and when I am in that mode, I make sure that everyone knows that I'm in that mode.
Good for you.
I cannot do this today. Could somebody please help me? Listen, my house, I haven't done the dishes in 2 days. Could someone come over? I am at that
Wonderful.
space where, because it's 20 years. So I went through different parts of, well, I'm not going to say much because nobody's going to help and but I don't do that anymore. And what I can do, I do. If I can't do it, I can't do it.
So is that how you can, because today you wanted to talk a bit about your mental health.
Yeah.
Is that how you manage your own mental health? Are there some other things that you do?
Yeah, there are other things that I do as well. I do a lot of movement. I call it movement yoga, and I do a lot of movement. Just I like to move because when I stay in one position, my body literally gets very sluggish.
Sure.
And when the body is in that sluggish mode, it feels as if depression wants to come in, anxiety wants to come in. So in me, just being able to, well, let me go outside, let me just walk down to the bottom of the garden and walk back up. And, you know, sometimes just do that 20 times. Or just sometimes if I'm at home, and I mean, my life don't permit me to do a lot.
Sure.
Because of the constant medication.
Is that the side effects of the medication
Yeah.
that you have?
So, I mean, I'm very fatigued most times. I'm very, very fatigued, but I don't know any other way.
Sure.
I don't know any other way right now. So,
do you know, we were talking earlier about conversations that we need to have with our children. You have 3 children, right?
Yes.
What are some of the conversations you have with your children?
All right. So on the 1st of the month, yes, my little 6-year-old daughter, she knows it's the 1st of the month.
Mhm.
and we go into the bathroom and we check our breasts.
Brilliant.
Yes. And this is my sons. I've already told my sons from when they're small, well, I don't know what you're going to feel. I don't know how it's going to feel, but I need you to get comfortable
Mm.
with your parts.
Yeah.
I need you to do that. And then when you see or sense something different,
You will be aware.
let's get on the program. You know what I mean? Because me having the BRCA gene can filter
Sure.
any which way for my children.
Mm.
So by them having this awareness, and as well as so like within their school lives, my boys are now adults.
Mhm.
Within their school lives, their friends knew that, yo, you have to check your
Check some.
balls, you know.
Yeah.
You know what I mean? And that's basically how they used to be saying it, you know, as a joke within
Mm.
them within
But
their
I guess it's
friendships.
however you get it across, isn't it? Whether it's a joke, whether it's a serious
Yeah.
thing. You've done a great thing by setting the first of the month, or you have a routine. You've done a great thing by talking to your sons about being aware about your own bodies, know your body, and also introducing that to your daughter. You've been brave enough and vulnerable enough to show your body to people so that they can understand what it might look like if that happens to them. You say you're somebody who's into lots of movement and you move about, and you know, and when you can't do the dishes, you say, I can't do the dishes.
Yeah.
And when you need some help, you need some help.
Yeah.
I think that's brilliant. Can we take some questions now, do you think?
Of course.
Is there anybody that has any questions for Hasta and her journey? Tia?
First of all, I want to say thank you for talking. Your
Yeah.
story is really impactful. I felt myself getting emotional like throughout. And I wanted to say that frustration you felt when you weren't being listened to. It's something that I've had a discussion about. I'm one of 4 girls, so I've heard the NHS doesn't really listen to Black women. I think
Yeah.
there's a statistic of like 1 in 4 Black women pass away during childbirth or something very
Yeah.
horrific like that. So it's something that my older sister and I always talk about in terms of being nervous when we get older to talk to the NHS when we feel certain things are changing about our bodies as women and stuff like that. How did you deal with that frustration of not being listened to? Because I can like that's unimaginable to me to feel that.
Yeah, I mean, currently still, you know, I still have issues around that, but I've learned over the time that your results, there's ways and means of getting that. Yeah, you contact the GP, you contact and ask them for the secretary number of the people who did the tests and follow up with them. You know what I mean? This is some of the things that I did. I empowered myself because there was no other way, and there was no other, you know, like, how do I get this information? You know what I mean? So me, some of the things that I do is I follow up. I follow up with whoever is the consultant, whoever is the doctor. I send emails, and I will send an email to you every single day until you listen. Because at the end of the day, it's 1 in 4 for breast cancer. You know what I mean? For different things, it's the statistics are too high, and for us to be listened to, and you have to still fight in 2023. We have to come up with ways and means of how to do it. And sometimes when we do it, it's like the angry Black people again. You know what I mean? No, we don't have to come across as the angry Black people. We can just send the emails out. And when it's an email, they have to answer because it's a paper trail. They will get audited. You know what I mean?
And there's an organization, I think it's called PALS, Patient something
Yeah,
something or other.
liaison, yeah.
But it is about finding it, because it's an absolute right, and you're right. It is almost unimaginable that you still can't get your tests. It's
Yeah.
almost unimaginable that you would have to go through what you go through to say, actually, somebody needs to hear. Ronald was talking about not being heard, not being seen. And so as a people, as a community, we have to stand up, but we have to stand up together.
Yes.
We have to support each other, because I do believe that there can be change, albeit small. There can be. Gussie and I have spoken about how long we've been working around bringing about the man van, and so Brent are now doing that. How many walks that we've done in the park, right, Gussie? How many banners there are like this? How many flyers? Gussie's done something in the community. Kevin is tirelessly doing things here. So the encouragement is for us to continue to support so that you can do what you do, so that this young man can get his test, so that Gussie can continue to do what he's doing. The work that's happening in Brent needs to continue. Are there any other questions for Hasna or comments? Questions?
Hi, thank you very much.
Mhm.
Just like you, I thought what you said was very impactful.
Thank you.
And I have a sister who recently died of breast cancer, triple
Sorry to-
negative.
Wow.
And I wanted to get tested for the BRCA gene and went through all the processes, and they said, like, no, you don't fit within the criteria. So just to let people know, there is a roundabout way of doing this.
Yes.
You can go on 23andMe. Yeah, 23andMe
Mhm.
is one of those like ancestry DNA type
Yes.
sites,
Yes.
and you can roundabout get it done. However, there are some emotional things about getting that test and possibly getting back something that is quite negative. But
Mhm.
just wanted to tell people that that's something that you can do.
Mhm.
With regards to the health service, I work within the health service. I manage things like complaints, and one of the things is that as a community of Black people, I feel we don't complain enough.
No.
We sit in silence a lot.
Yes.
Okay. And one of the things you can do, there is a central complaints
Yes.
with the NHS. Complain
Yeah.
and go to your MP
Yes.
and ask your MP to go on your behalf. I get loads of letters in from MPs where people have gone to the MP and said, I'm not happy with the GP service. And the MP will have to follow it up.
Yes.
Okay, so that's another thing. Health Watch. You spoke about PALS. PALS is still there in a form, but Health Watch is another organization that will advocate on your behalf. So if you go in there, you say, look, you know what, this is happening to me. I don't feel confident. They will give you someone who will go on your behalf and send the emails for you.
Yes.
It's so important that we keep on, okay? And actually ask your friends, your family. Don't be afraid to do that.
Yeah.
But I want you to say to you, God bless you.
Thank you.
I hope that on your journey, you just keep on fighting. You
Thank
are
you.
full of power, and you gave this room power today.
Thank you. Thank you. Thank you so much. To God be the glory. Thank you.
Thank you. What a beautiful common exchange of emotions. And that's what we're talking about in terms of support. Don't go away. I need to speak to you before you leave. So, any other comments? Alison at the back.
I'm blushing.
Before I break down and cry.
That's my darling there. Yeah, well, that's
Yes,
fine.
well, I just, well, everybody doesn't know, but Hasna knows that I think she's the most amazing human being I've ever met. And it's always been a pleasure, you know, when you call the dishes or the whatever,
Yeah.
where they're always there.
Yeah.
And I really love it. And it's an honor and a joy to be there for you when
Yes.
when you call.
Yes.
Because I think I don't understand in my head how any one person can go through what you go through.
Yeah.
But I did want to ask about the trial.
Mhm.
Is that something that you could participate in indefinitely, or will they stop you, or how does it work?
Okay, so the trial that I am on right now, okay, this is new news. So
I think for Hasna, knowing that she was going to be talking today, although with the timing, what we didn't know was that she was going to get some new news this week. So she's arrived today with some new news. So that's her struggle today.
yeah, anyway, let's go. All right. So the new news is I recently had a scan and one of the nodes is inflamed. I had a MRI on Friday, so that was okay. I'm waiting for my CT scan, and I also had some other blood tests. However, I am this type of person, as I said, you know, my life has always been, it has been ordained already. You know, God is in control of my life. So I always get the right questions to ask my consultants, you know, and they answer me very, very straightforward. So I always ask, so what's next? I know this is maybe going on the down. I don't know. I said, because we don't have the full information. And I try my best not to get too anxious because if I go that space, I could. It's very difficult to come back up. You know, so when I got that, when I get all the information, then I can make a better decision. You know, because I have information. You know. However, it's like at this stage here, you know, it's this. I played carnival. You know, I played carnival, and it's just to show that life continues. You know, within everything that you're going through, the life is still happening inside of you, and I think that's what God has given me. God has given me this life, and I live it. I live it to the best. Um, I believe that we all have that, and when we do have it, don't take it for granted, you know, and just live it. Try to live it as best as you can. Um, oh dear.
Wow, Hasna says, live it. Live it as best as you can. And you do a really, really good job of that. And there is absolutely no expectation
No.
that every day you will be doing carnival. There is no
No.
expectation that every day you will be grinning. But you do a lot of that, though. So
I
that's
do.
really good.
That's the
You
thing.
do a lot of that. But you show everybody your level of vulnerability.
Yeah.
I feel your story in the seat of my soul. It touches my core every time. And I'm sure there is always at least one person in every room that you are in that knows that you are there. So I want you to know that we see you. And, you know, I don't really like washing dishes, but I kind of don't mind coming and washing a few plates.
we'll
I
have
got a
good time.
dishwasher,
We-
but I don't mind getting a sponge out and doing some dishes round at yours. And I'm sure there are people here that are now thinking, I might have to go around and wash a few plates. So we have got you. Are you going to wash some plates? Chris is going to wash some plates. We have got you. And thank you so much today again for sharing your story. And I know that you and I are going to spend
I
more
just want
time
to continue
together.
to answer the question. So, what's available to me? Because I still have things that's available to me in London. So there are 2 other drug trials that I might be able to if this one doesn't work. But I mean, I am very grateful to be in this space in the UK where research is happening so much. And I am one for telling our people, you know, to mean put ourselves out there. We have to put ourselves out there. Make yourself be heard, you know what I mean? Make yourself be seen, you know what I mean? And there's ways to do it. And I mean, it can be done because I didn't know how to do it, and I'm doing it solely by, you know, the strength of myself and the strength of the Most High. You know what I mean? So it can be done, and you know, in the sense of trials and stuff like that, put ourselves forwards for clinical trials. We have to get our information out there so that we can be counted. You know? Yeah. Yeah.
Thank you. Well done. So Hassan, you've done a great job today. Thank you so much. I think, yeah, we're just going to celebrate you, give you a clap, and send you back to your seat. You've done awesomely well.
Thank you.
Give
very
her
much.
a round of applause. Was there something you want to say, Chris?
No, I tell her I'm serious about doing the dishes and stuff.
Thank you very
okay?
much.
I'm
I
serious.
appreciate that. Oh,
Let's get we're going to get Val to
you see,
set
this
up a
is
rota.
this you see, this is what speaking brings out. You know what I mean? Because it's not only me like this in the community. There's so many other people like me. I mean, I'm not well, and I volunteered to one of my neighbors down at my street, you know, and she is very vulnerable. And sometimes I say, "But Hasna, you're vulnerable," but then I look at her and I think she needs the help. And as a community, we have to be able to help each other in the sense of in-house things, you know what I mean? Simple things, you know, go and tidy up somebody's front room, pick up the grass in the front. It doesn't cost anything.
Because that
to
makes
do,
a
you
real
know?
difference, doesn't it?
It makes a big difference. And the person who's receiving it, like when my crew come over and then they just decide, like, oh, they're gonna take over and just do everything. I'm like, oh my God. Oh my God. You know, it's a very good feeling. And it's a feeling that we've lost as a community.
That's
when
given
we
me a
don't
good
have it.
idea, actually. That's given me an idea. Watch this space, guys. That's a good idea.
Household community,
Household,
I'm
yeah.
sure, you know.
Let's have a chat. Let's get that one going. Well done. Okay, so wow. I guess that brings us to the close, really, of today. What are the thoughts that some of you have had that have been here today? Do you have a thought? Or you was just moving? See, don't even move in here, you know, you'll get the mic. What are the thoughts that some of you have had about today? What you've heard from Dr. Jonathan, what you've heard from Ronald Ferguson, what you've heard from Gussie Young. We've had young Tia earlier talking about how this whole started. Are there any comments or thoughts around today? Okay, that sounds like a resounding no. Oh, thank you. Come on, Kimmy. What are your thoughts about today?
I was just going to say, you know, when Hasna was talking, I know Hasna a few years now, I see you every carnival. I see you once a year. You see so many people once a year, but you don't know their story. And this absolutely makes me realize you have to take the time to ask people what's going on, how are you doing, and just show compassion and empathy. And I think you've just gained a house load of people here ready to come and help you. I'm not good at washing dishes either. I leave loads of mess on the floor, but I'm willing to come and help as well. And I think you're right. We do need to speak more. We do need to act as a village. We do need to look after each other. And just be there for each other and encourage each other. So when Dr. Jonathan Consultant was speaking as well, everybody, you know, you've got a father, a brother, etc. And we absolutely need to encourage each other to go and get checked. I learned so much today. So much. I mean, the statistics, the fact that there's no national screening, that's shocking.
Really, isn't it?
Shocking. I was speaking to him outside about, do we need to, as a Black people, form our own community to look after ourselves, like the Jewish community look after each other? Do we need to form our own national screening platform and take matters into our hands and look after each other? Because the statistics are alarming, it's shocking. And instead of killing each other on the streets and, you know, just thinking about carnival and whining and what have you, this is important.
And that's a good point. And so I have to tell you, I refer to myself as the author of my own life, because quality of life is so important. And I vowed that I wouldn't do 9 to 5 because I didn't want to be contained like that. But I was headhunted for a position around being the community cancer awareness person advisor. Still haven't got the title right. And I took that because there's something that needs to be done. And hearing some of the things that you guys have said today about, do we form our own? How do we come together? How do we share? Do we get together collectively and support those that need support? How do we raise the alarm of 1 in 4? How many of our white counterparts would go to the GP and say, I'm still waiting for my results? And why are we having to fight for our results? So there is some work to do, and I'm super excited about what the next couple of years look like. And so I'm urging anybody that's interested to either leave your details with Kevin. I certainly will be leaving my details with Kevin. And myself, Val, who's behind the camera, we're going to be working collectively to make some changes. And I don't care if we only make changes in this shop, but we need to start. If what you have in your hand is not your harvest, then let it be your seed. Today is definitely a seed that we will make our harvest, because we are deserving to not be 1 in 4. Tia, were you going to say something?
Yeah, I just wanted to say, as he's in the room, like, we're talking about helping the community and everything like this. And I just wanted to take the opportunity to thank Kevin as well for using Main Culture as this opportunity to help the community, because we are having this conversation. You're talking about the seed being planted, and this is the place where, you know, this seed is being planted today. So just wanted to say thank you to all the speakers as well for coming in.
And that actually, Tia, you are a seed, because you're one of the youngest members. I mean, we have young as I today, but generally you're one of the youngest. So I want you to know that you are a seed, and I've seen you blossom already today. So Kevin, you are doing some great things here. The work that you do is phenomenal, and we really salute you. I'm always moved by, you know, your sheer ease in opening your space as if it's your home. And I love you for that in so many different ways. And so thank you to everybody for coming today. This is the close, but stay around, have a chat, exchange numbers. Don't leave with an idea or a question that you might not have felt comfortably asking in the group. We are still here. You can have that conversation and watch this space. It's your girl Blaze, and I'm out. Well done, everybody.